Hello students, good evening. Welcome to one short series. Today's topic is identification. Am I audible and visible? Can you just type hi in chat box? Yes guys, are you there? Yes, Menak Datta. Yes, thank you Menak Datta. Good evening. Good evening others. Just say hi. Good evening all. Sabko namaskar. Welcome to one short series. Yes. Chalo, let's start. So, as you know, identification is one of the very important chapter commonly asked in INICET, NEET PG exam. Prajwal, good evening. Yes, Menak Datta. Okay. As you know, there are two types of identification, absolute identification and partial identification. Identification means exact fixation of personality. Identification is very important in living person as well as in dead person. Let's start one very important topic. Okay, Agarwal, Adarsh, yes, you are there. Okay, yes, Agarwal. Okay, let's start. Can you guess what is the most important topic in forensic medicine, that is identification? Agarwal, Menak Datta. Have you seen this movie Detective? One of the very nice movie, a movie based on robbery, and robbers are identified with the help of one very important identification data. Can you guess what is that identification data with the help of this picture? Yes. Come on, come on. Very famous movie. Yes, very good. The answer is fingerprint. The fingerprint is one of the absolute identification data in identifying criminal. Fingerprint. See, most of the applications now, including your mobile, Aadhaar card, bank account, related to this fingerprint. The fingerprints are formed by epidermal ridges. They are specific to a particular person. Good answer, Menak. Okay, with this introduction, let's start. So, this is the fingerprint that is formed by the epidermal ridges. Just remember one important funda, the core and delta. Yes, movie name is Kaki. Fine. Vijay. Core means curving ridge. Delta means 3 directional meeting point. One very important concept. बार बार पूछते एग्जाम में. The curving ridge is core. 3 directional meeting point here is known as delta. One core, one delta, that is loop. 2 delta, that is basically oval. No delta, no core, that is arch. When it is mixed, basically known as composite. Yes, Agarwal is South Indian movie. Thiran Adhigaram Ondru is the actual movie name. And as you said, it is Khaki. Fine. Can anyone identify the type of fingerprint here? Look at this fingerprint. So, entry point, exit point on the same side. What is this fingerprint? Yes, Vanakkam, Agarwal, Adarsh, come on, try. What is this fingerprint? क्या है बताओ ये? So this is basically loop. So in loop there is one core and one delta. Good. And he is the father of fingerprint, William Herschel. As you know, the first fingerprint bureau was started in India, in Kolkata, by William Herschel and Francis Galton. It is further improved by Henry. That's why it is known as Henry Galton system. Let's start some important MCQ commonly asked in the exam. The first MCQ, it is also known as dactylography, the most reliable method of identification. It is also known as Galton system. As I said, it is discovered by Galton. Fingerprint system, dermatoglyphics. So they are formed by epidermal ridges. Okay. Complete formation by 24 weeks, around 6 months. याद रखना, viability means 28 weeks. The center of viability, that is talus. The proof of identity during comparison, we compare around 12 points as per Locard. First used by William Herschel in 1858, Francis Galton, improved by Edward Henry. First bureau was started in Kolkata, Writer Building, important MCQ. Then types of fingerprint. The first type and the most common type, that is the loop, 60 to 70%. In loop, there is one core, one delta. So all of you write, loop is equal to one core, one delta in the chat box. Manak, please write. Loop can be ulnar loop or radial loop. This can be MCQ. Second one, OL. In OL, you will see central circle. When there is a 360-degree circle is there at the center, then it is known as OL. That means snake jaisa hai. Okay. In OL, you will see two delta. You will see complete circle. At the center. And the third one, arch, is around 5 to 10%. Here, no core, no delta. And yaad rakhna, entry point and exit point on different side. For example, this is loop. This is OL and this is arch. Okay, very commonly asked MCQ. Then composite matlab mixed hai, around 2 to 3%. Remember, most common fingerprint is loop, the least common fingerprint is composite. Now is your turn. All of you identify this one. Can identify ABC? Try, come on. So what turn? Manak Datta, Rakesh and others, Aishwarya, Sudha, Agarwal, Vijay. Can you try? Are you there? Yes, Aishwarya Baligar is answering loop. Excellent, Aishwarya. So this is loop. This is all arch. Okay? It's very simple. Now, one very important question asked is the mutilation of fingerprint. Bit difficult one. The pattern is retained, but change in the distance between the ridges. Change in the distance in particular disease. Answer must be acromegaly. Acromegaly, as you know, hypersecretion of growth hormone from the pituitary gland. Rickets because of vitamin deficiency in children. This can be MCQ. Moderate epidermal ridge atrophy. I said in the before, epidermal ridges, they form fingerprint. That occurs in celiac disease, gluten hypersensitivity. You will see dermatitis herpetiformis in that. Incomplete ridge atrophy, dermatitis, inflammation of skin. Like example, hewn hand caused by the chili seeds. Permanent loss of fingerprint, MCQ, very, very important, dairy milk question. Your answer must be radiation burn, leprosy or Hansen disease, electric burn or Joule burn, and a drug known as capecitabine. And last one, ridge alteration that occur in scleroderma, limited scleroderma. This is one very important 5 marks question, 3 marks question, Viva question, INICET question. Okay? Yes. Now, just a revision here. You can see here this image, acromegaly है. ये क्या है? Dermatitis herpetiformis है. The feature of celiac disease. This is Hansen disease, scleroderma, and this is dermatitis. Very interesting image. Good. Now look at this fingerprint. Is there any fingerprint here? Can I make out the fingerprint in this condition? Yes, come on guys. Fingerprints are absent in some condition. This can be asked in your exam. There are various conditions. Basically, they are genetic conditions. एक है बैड सिंड्रोम. क्लास के बाद just go through Bates syndrome in medicine. Zinsser-Kolle-Ingman syndrome. Nagelli syndrome. Dermatopathia pigmentosa reticularis. And last one, adermatoglyphia. So, all these are the syndromes, genetic conditions where fingerprints are absent. Good, Manak Datta and others, great, all answering. So, chalo. I hope you understood fingerprint. 5 marks question, Manak Datta, can you able to write? You need to write what is fingerprint, types of fingerprint, who discovered it, mutilation of fingerprint, genetic conditions in which fingerprints are absent. Yeah, is it okay, Rakesh? Sure. Next, there is something known as poroscopy. Poroscopy is study of pores, the pores of the fingerprint. As you know here, all these are pores. When partial fingerprints are available, this poroscopy is very useful, like size of pore, number of pores, shape of pore. The study given by Lockhart, which is known as poroscopy. This is poroscopy. This can be asked. And you can make out here, all these are pores. And this is fingerprint. In between, you can make out small perforations. They are basically opening of the sweat glands. The study of this is very useful when partial fingerprints are available. Good. Chalo. Next, we have some 10 questions now. So let's discuss here, there, along with the MCQ. Are you ready? Ready for the MCQ? 10 MCQ. Let's see how many of you are going to answer. Rakesh, Manak Datta, Arish, Raviraj, Kumar. Are you ready, guys? Say yes or no. Come on, guys. I'm waiting. I'm waiting for your answer in the chat box. Come on, come on. Try. So you are winner. We are winners. World Cup winners. One shot series. Rakesh ready. Arya Kumar ready. Manak Datta ready. Ready. Good. I am ready. You are ready. Aishwarya Begal ready. Great. Chalo, let's start. Aryan Kumar also ready. Good, Aryan. Good. First question. Corpus delicti means. Options है proof of occurrence of crime, decomposed body, identification of dead person, alger mortis. Alger mortis is postmortem cooling. It is not the answer. So D ruled out. Identification of dead body, that is not corpus delicti. That is the duty of the inquest or police officer and the doctor. Decomposed body, yes. So answer is A more than B. The corpus delicti is essence of crime. Say example in murder, to prove murder, we need dead body. Court will ask, where is the dead body? Where are the findings? The corpus delicti is essence of any crime. Okay? Answer is basically A. Answer given by Raviraj, no. Aishwarya, no. Yes, Rakesh, good answer. Rakesh answered correctly. Answer is A. Good. Manak Datta, yes, fine. Second question. Age estimation from the teeth can be done by all the following methods except teeth. Gustafson method. Yes, Gustafson method is a method of age estimation having 6 criteria. The mnemonic is APSRTC. Attrition, parodontosis, secondary dentin, root resorption, T for transference of root, cementum opposition. So, yes. Answer nahi hai. Miles method is a method of age estimation by using dental attrition. Boyd's method by looking at the incremental lines. Sujiki classification. याद रखना Sujiki है ना, that is basically lip print. So answer क्या है? Answer है Sujiki classification. Answer is D. So first answer given by Manak Datta. Good answer. Manak Datta. Great. Now try to understand Sujiki means lip print. It is very useful method in identification, but it is not accepted by the court. And this is actually the lip print. The very interesting picture. Look at this. There are different types of lip print. This is type 1, where it covers entire lip. Type 1 prime, again linear, not covering entire lip. Type 1 prime. Type 2, somewhat Y-shaped, branched, Y-shaped. Type 3, that is X-shaped, crisscross pattern, like this. If it is reticular, type 4. If it is mixed, that is type 5. So this is fingerprint. Sorry, this is lip print, commonly asked. Okay, Manak, this can be a 5 marks question. Try to memorize. Linear है type 1, Y shaped है type 2, X shaped है type 3, reticular pattern mesh जैसा है, that is type 4, mixed है type 5. Remember, court will not accept this. This is only for the investigation purpose. Sujiki classification. Yes. Chalo. All of you write Sujiki classification in chat box. You know Sujiki, Hero Honda, Sujiki. Come on, guys. Manak, please write Sujiki. Okay. Chalo. Next question. Patient relative gives history of tattoo. A tattoo is a method of identification. By looking at the tattoo, you can identify personality. Like example, if bluebird sign is there, homosexuality. If some picture of, bluebird sign, homosexuality, or it can show a religion also. Various importance of tattoo mark. However, it was not found during the autopsy. What should be dissected to find out? Very simple it is. Very simple question asked in exam. Lymph node. आंसर क्या है? lymph node है. It is not skin. So skin is preserved in injection mark, in ballistic injury. The spleen is preserved in cyanide poison. Like example, curry and cyanide case, a recent web series. Curry and cyanide, coffee cyanide case, apple seeds. ठीक है? Kidney preserved, normally it is preserved. In any case of poisoning, half of each kidney is preserved. Answer है lymph node. Good, many answered, that's great. Duty also. Fourth question. Most reliable method of identification of an individual even in identical twins. A good question. In identical twins, DNA fingerprint is same. That means V and TR is same. Variable number tandem repeat is same. So answer is not DNA fingerprint. Bertillon system is anthropometry, height and weight of the person. Gustafson method is a method of age estimation, not the method of identification. Answer है fingerprint, also known as Galton system. B is the correct answer. Now one interesting question. Duty, good answer. I think many answers. Sydney shark case, okay. In humans, cortex of hair is usually, okay, cortex of hair. For example, this is the cortex. ये cortex है and this is medulla. ये medulla है. Answer बताओ. In humans, cortex of hair is usually 4 to 10 times broader than the medulla. Answer is C. The medulla is very thin and it is discontinuous in humans. But in animal hair, the medulla is very thick. ठीक है? Answer क्या है? C है. I think fifth question nobody has answered. No, Aishwarya, no. Manak Datta answered. That's okay. Manak Datta, good. Aishwarya answered D. Duty answered C. Duty, Bomik, good answer. So try to remember. Very interesting picture. In the human hair है ना, cuticle is absent. Medulla is thin. cortex is large. In animal hair, like dog hair, medulla is thick, cuticles are present. Medulla and cortex ratio, it is less, almost equal only. Good. Chalo, ho gaya. All are true about physiform except. Now, one question about ossification centers. Physiform is the smallest bone, carpal bone. As you know, she looks too pretty, try to catch her. It's the smallest carpal bone, P-shaped. Last to ossify. True about this. It's a sesamoid bone. True hai. True. Can be seen on newborn X-ray. Newborn X-ray? No. It is normally seen in 9 to 11 years. Attached to flexure carpi ulnaris? True. Last carpal bone to ossify? That is true. Answer kya hai? C is the answer. So this is how you should answer. Now let's have a discussion about carpal bones. It's a very important topic. Let's have a discussion. See, this is capitate, largest one, capitate, which appears at 2 months. Okay. The next to that is hamate. So capitate, hamate, physiform, and triquetral, that is proximal row, distal, that is basically distal row, and the proximal row we have scaphoid, trapezium, trapezoid, okay, and physiform. Okay, yes. Just go through the the age of ossification of different center, the lower end of radius and lower end of ulna. We discussed beautifully in our classes. Just go through that. It takes around 30 minutes. So time being, remember, physiform is the smallest carpal bone which ossifies later at the age of 9 to 11 years. Good. Hari Prasad, yes, 12 years also fine. 9 to 11 years also fine. Okay. Single most reliable criteria in Gustafson method. Gustafson method is for age estimation in dead individual after the age of 25 years, 25 to 40. It has 6 component. Mnemonic है APSRTC. A for attrition, P for paradontosis, S for secondary dentin, R for root resorption, T for transparency, very important topic, and C for cementum opposition. याद रखना APSRTC mnemonic. So all of you write in the chat box APSRTC. Keep writing. So which is the best criteria? Answer है root transparency. Best criteria. Second best criteria, secondary dentin. Attrition is wear and tear. Paradontosis is loosening of the teeth. Root resorption is because of the osteoclast, the size of the root decreases. Transparency and translucency both are same. It increases as age advances. Cementum opposition basically incremental lines. Best criteria transparency है. Second best criteria secondary dentin है, not primary dentin. Good. Yes, Rakesh, Menak, Aishwarya, Dhruti, good. See, this is the method we use, that is Gustafson method. Normally we use front teeth, the incisor and canine, not the molars. So it consists of 6 criteria. There is a formula also, +1, +2, +3, +4. If mild change, no change, +1, +1, mild, moderate, and more change. That is basically calculation is there in that. This is Gustafson method for age estimation. Chalo. Now very interesting picture. One of the best cricketer, Chris Gayle. Okay, Chris Gayle from Africa, South Africa. My question is, what is the importance of cephalic index? The cephalic index is the maximum breadth of the skull divided by maximum length of the skull multiplied by 100. Depending upon cephalic index, the skulls are classified into dolichocephaly, mesaticephaly, brachycephaly. Dolichocephaly 70-75 है, Africans and Aryans. Mesaticephaly, example Europeans. Brachycephaly, Mongolians. Usually that is more than 80 in Mongolians. Hyperbrachycephaly more than 85. Most of the Indians usually mesaticephaly. So what is the best answer then? So the answer is basically race. That is maximum breadth divided by maximum length multiplied by 100. याद रखना, cephalic index is minimum in dolichocephaly, but anteroposterior diameter is maximum in dolichocephaly. INICET question. ठीक है? Fine, understood guys? It's easy. Next, very important question. Very, very important. More prominent in males. Parietal eminence, mastern process, both of the above, none of the above. Yes, yes, द्युति मैनक. बताओ, जल्दी बताओ, क्या आंसर होगा? आंसर क्या है? Mastern process is prominent in males. Okay. Alka Kumari is telling sir C. Both of the above. Duty is also telling C. Okay. चलो देखते हैं क्या आंसर है. Parietal eminence is prominent in female. As per my knowledge, very important question. Answer only B है. Only B. Now look at the skull. This is a very nice picture that is showing male and female. Say example, now you are in the crime scene. There are two skulls are there. Okay, two skulls are there. In one of the case in Karnataka recently, we found 6 skeleton in a house which was closed since last 5 to 6 years. Almost during 18-19 time, COVID time, it was closed. The one day the neighbor found 6 skeleton. Out of 6 skeleton, one was dog skeleton and there were 5 human skeleton. In that case, as a forensic expert, my duty is to find out. ठीक है? अच्छा, मेल लिखा है, देखो मेल लिखा है ना बेटा. My duty is to find out the whether male or female gender, age, possible the height of the person, if possible race. So there are 4 important components. एक है race, दूसरा है age, gender and height. So depending upon that, we are going to do matching, superimposition and all. In that case, Chitradurga case I said in Karnataka, 5 skeleton, all were in skeleton stage because the house was closed since 5-6 years and very unusual case. ठीक है? In that we came to know 3 skull belongs to male gender and 2 skull belongs to female. My question is, among these 2 skull, which is male, which is female? Come on, Ahmad. यार ये है, बी है, देख के बताओ. ये देखो राउंड है, राउंड ऑर्बिट है, इसमें देखो रेक्टेंगुलर है, रेक्टेंगुलर एक पॉइंट है। फोरहेड, फोरहेड है, स्ट्रेट है, इसमें इसमें स्ट्रेट है, इसमें स्टीपर है, स्टीपर फोरहेड। Look at the mandible, mandible is U shaped, ठीक है। हियर मैंडिबल है ना V शेप्ड है, ठीक है। ये देखो U शेप है, ये देखो V शेप है। नाउ बताओ विच इज मेल एंड विच इज फीमेल। ओके अहमद, थैंक यू अहमद, ग्रेट टू सी यू इन द क्लास, गुड। हाँ, नाउ वेरी सिंपल, वेन एवर स्टीपर फोरहेड, U shaped mandible, rectangular orbit, frontal parietal eminence is small, male है, so this is male, no doubt, and this is female. So look at the forehead, forehead steeper है, male है, forehead straight है, female है. So one very important funda. I think I hope you are getting my point, guys. And rest all very easy. Supraorbital margin is prominent in male, less prominent in female. Most of the bony markings, you take any bony marking, Marshall process, foramen magnum, muscle attachment, everything is prominent except frontal and parietal eminences. In female, everything is not prominent except frontal parietal eminence. Very important. Duty is telling, sir, Buck-Ruxton K superimposition. Great. Good. Chalo. Next. Absolute identification given by, absolute मतलब 100% is given by. ऑप्शन है कीलोस्कोपी है, डीएनए फिंगरप्रिंटिंग, डैक्टिलोग्राफी, रेटिनल स्कैन. डेफिनेटली नॉट रेटिनल स्कैन. Not absolute है, definitely it is useful but not absolute. Cheiloscopy lip print है, again it is good only but not absolute. DNA fingerprinting, VNTR, but not useful in identical twins. याद रखना. The best answer है ना dactylography. C is the answer. I think many answered B. Duty answered B. Manak answered B. The best answer I go with, C is the correct answer. Fingerprint can't be same even in identical twins. Yes, you are C, okay, I agree with that. Between B and C, the best answer dactylography है. समझ में आ रहा है ना मेनक? चलो. Now interesting picture देखो. Identical cricketer है, I think from New Zealand. In identical twins, VNTR is same, DNA fingerprint is same. We cannot identify with the help of DNA fingerprint. In that, you use fingerprint. Fingerprint is different. So this is the importance of forensic medicine. I hope you understood the important topic today. Any doubt in today's session? Guys, Manak Datta, are you there? Any doubt you can ask me for next 5 minutes. And meanwhile, I have a question for you. Wait. Now look at this. Now real example I am showing you. ये देखो, दिख रहा है ना आपको? Say hi, hello, hi to our friend. Boni. Yes, Menak, Duty. Hi बोलो पहले. A real skull, human skull. ठीक है? And in this skull, I think Jyoti and others, say hi. Hi, Boni. Rakesh. Orbits are rectangular. You can make out here now. Very clearly visible. Forehead देखो. Steeper forehead है. Steeper forehead. Supraorbital margin prominent. Frontal parietal eminence is not prominent. Bony markings are prominent. Now look at the side. This is mastoid process. Mastoid process is clearly prominent. Look at the foramen magnum. Large है, small नहीं है. ठीक है? So male or female? Now try. Yes, good answer. Duty is telling sir male skull. Now I have one more question. What is the age of this skull? Now look at the sagittal suture. Now concentrate guys. Concentrate. This is sagittal suture. We can make out here. In sagittal suture, it is not fused. It's clearly open. When you pass the light, you can see the light rays from the opposite side. It is not fused at all. In anterior 1/3, posterior 1/3, middle 1/3, it is not fused. Now my question is, what is the probable age? Very interesting है. देखे बताओ. Remember, sagittal suture fuses in 3 segments. Anterior 1/3, posterior 1/3, middle 1/3. The most anterior part or the posterior part fuses in less than 50 years. Different books is different answer. The last part to fuse is the middle part. Here it is unfused sagittal suture. The age less than 40 years. So age of the skull is 40 years, less than 40 है, और gender है, that is basically male. And look at the skull. The cephalic index is 78, 79, less than 80. Then it is mesaticephalic, belongs to Indians. So this is how you can calculate the age of the person, gender of the person, and also race of the person. Yes, we are coming up with some more beautiful session, one short session in upcoming days. I hope this class was useful, a short sweet session. Thank you all. See you in next class.